Well, the COVID-19 pandemic has affected all of us in more ways than one. The almost two-year crisis led to a surge in anxiety and depressive disorders across the world. Here in the country, data from the World Health Organization show at least 3.6 million Filipinos suffered from mental, neurological, and substance use disorder in 2020. And women are among those who've been badly affected by job loss, poverty, and domestic violence. Well, good thing there are groups out there dedicated to addressing our mental health needs and overall well-being. Empath is one of them. It's a social enterprise which aims to improve accessibility to mental health care and psychoeducation. It's founded by a 24-year-old mental health advocate who herself has her own mental health struggles. Steph Naval, founder and CEO of Empath, now joins us live via Zoom. Hi, Steph. Good morning to you. So happy you could join us.
Hi, good morning. It's great to be here.
Well, first up, how did Empath actually start? We understand even before the pandemic, you've already pitched this idea during the United Nations Global Impact Challenge. Tell us more about that.
Yeah, so Empath started because of my personal mental health struggles with especially when it was so difficult to navigate it through the mental health care system in the Philippines, since there's a lot of opportunity for growth for it. And after I decided to pitch it with the United Nations Global Impact Challenge in 2019, and after that United Nations Global Impact Challenge, this was something I was really passionate about and wanted to pursue, and it was officially incorporated August 2020.
What an incredible journey this must have been, not only for you, but for Empath as well. As you mentioned yourself, you yourself had your own mental health or personal experiences with the mental health care systems. What inspired you? Tell us a little bit more in detail about that.
Yeah, so for me, it was the personal pain points growing up here in the Philippines. I could see that there was a lack of mental health care accessibility, especially with everything that's been happening. And at first, I was going to wait a bit when I got older to start a business, especially with mental health company. But then I was really compelled by the pandemic because it was a real rise and a huge spike when it came to mental health cases, especially for students, teachers, women, and especially in the workplace.
That's true. You came actually at the right time. A while ago, we touched a little bit about the effects of the pandemic on our mental health, and we actually mentioned that there were about 3.6 million Filipinos that were affected, and we are so, fortunate to have you, female, since we celebrate Women's Month, to help us bring this all together. Tell us a little bit about your experience in terms of how the pandemic affected gender equality and the quality of life for women.
Most definitely. So, for example, we do community programs, especially with mothers, survivors of domestic abuse or even sexual abuse. And we really reach out to these communities to provide, for example, free telemental health platforms, and also community programs as well for them. I think it hits mostly also the mothers because there is a standard wherein they have to cater to both the family and also work and the schooling of the children and everything. So I think with all the mothers out there and the women out there, really stay strong. Really appreciate, and I really hope that you take the measures to take care of your mental health.
This is real. It affects everybody. And as you said, it actually, it has grown so much. And of course, we're trying to eliminate the stigma associated with mental health issues, and we're happy that you are there. So once again, for the benefit of our viewers or all those that are going through tough times right now, tell us more about the different services available at Empath. We understand that you do have counseling services, mental health workshops, and webinars available for anybody interested.
Yes, so we have several services. We try to be holistic, especially catering to the sector you want to serve. So there's telemental health platform. We have psychologists and psychiatrists to address your needs. We also have mental health workshops and webinars, even wellness classes, such as a mix of, let's say, mental health and coffee painting or acrylic painting. And also we do policy and program development as well when it comes to companies, even schools, and hopefully maybe we can partner with LGUs or local government units.
All right. Well, thank you so much for sharing your journey and, of course, for being with us this morning on New Day. Once again, Steph Naval, maraming salamat.